Hi, my name is Amy Sullivan, and I'm presenting on feline parvovirus, also known as panleukopenia. Feline parvovirus is a highly contagious and potentially fatal disease that affects cats and kittens. It attacks white blood cells, weakens the immune system, and can cause secondary infection and attack the GI tract. Because it is a virus, there is no cure. It needs to run its course. It is highly contagious from cat to cat. Dogs can get parvovirus too, but the feline version is only contagious to other cats. Because of the high contagious factor and potentially high rate of death, this is a disease that shelters need to be cognizant of and take all precautions to prevent outbreaks. I wanted to touch base on information that can help both shelter staff and foster homes avoid spreading the disease because these are two places where they are at high risk for outbreaks. Clinical signs most often include diarrhea, often bloody, vomiting, lack of appetite, lethargy, dehydration, or a combination of these. It can also present as sudden death. Symptoms may be mild or severe. It is case by case. In shelters, an IDAX SNAP test, which is a point of care test, is highly sensitive and can give results quickly. This is the recommended test for shelters. However, it does have a potential to pick up false positives in animals who were recently vaccinated. While it's rare, it is a possibility. If parvo is suspected and the test is negative, other testing options may include a CBC blood test. A low number of white blood cells is classic in FPV. A PCR test is also another way to test, or it can be used in conjunction with a SNAP test. Feline parvovirus is everywhere in the environment, and most cats who came from the outside are exposed at some point. We should be concerned because an outbreak can wipe a shelter or foster home out. However, proper precautions can help prevent this. Kittens, elderly cats, and immunocompromised cats, such as those with FIV and feline leukemia virus, are at the highest risk of contracting the disease. I wanted to focus on foster homes as well because kittens often go into foster care and are definitely at a higher risk of contracting feline parvovirus. While adult cats can also contract it, they typically have a better immune system or are fully vaccinated, so they might fight it off on their own without ever becoming ill. The most effective way to prevent feline parvovirus is through vaccination. Vaccination is also one of our toolbox tools. The FERCP vaccine prevents against parvovirus. All cats 4 weeks or older should be immediately vaccinated at intake at a shelter. Kittens should receive booster vaccinations every 2 weeks until they hit around 20 weeks of age and are not considered fully protected until 7 to 10 days after their last vaccination in the series. When kittens go to foster care, it is important to ensure that foster parents are educated to bring the kittens back for booster vaccines to keep them protected and on schedule. Feline parvovirus is spread through fecal oral route as it is spread in the feces of infected cats, but it can also be spread through fomites, which is when something is contaminated with the virus, cross contamination, such as shared items, and from pregnant moms to babies. It can even be spread from one worker touching an infected cat and then touching another without proper sanitation. Tools that can help prevent the spread of feline parvovirus in the shelter or a foster home include using proper personal protection equipment, such as changing gloves between handling unrelated cats or washing hands in between each litter of cats. Avoiding overcrowding, because overcrowding can mean staff doesn't have the time to take proper precautions with PPE, and that cats are more likely to spread disease to other cats. You can also use an effective cleaner that kills parvovirus, as many common household cleaners do not. Accelerated hydrogen peroxide is a good cleaner choice that does effectively kill the virus within 1 to 5 minutes of contact time, depending on the dilution. Bleach at a 1 to 32 ratio is also a good choice for foster homes if they don't have access to other cleansers. Not mixing unrelated cats or litters of kittens, both in the shelter or in foster care, can help control the spread of disease, and housing higher risk animals, such as kittens, elderly cats, or immunocompromised, separate from others, can be another way to help prevent the spread. If we have a positive case, either in foster care or in the shelter, these tools can be used to help manage it while minimizing the potential of spreading the disease. First, we need to isolate affected cats from others. In foster homes, this might mean that they're in their own crate in their own room, especially in an easy to clean area such as the bathroom with no carpet. In shelters, this could mean moving to an isolation room. Next, quarantine any exposed cats, such as littermates or cats who might have come in contact with infected cats or were exposed through contaminated items or staff. Quarantine in place with proper precautions, such as staff being extra careful to use full PPE, changing protective gowns and gloves, or even better, having staff assigned to dogs handle positive cats, and then putting proper signage on the kennels while monitoring the cats closely for signs of disease can be a decent option. Be careful not to move them around during the quarantine period to avoid potentially exposing other animals or kennels. If more cases continue to pop up, we can consider a clean break, meaning we stop intake of new cats or kittens at the shelter until the outbreak is resolved. In foster homes, I would always recommend a clean break if they have a positive animal. There is no reason to send new kittens who are at higher risk of getting ill to a foster home who already has an affected animal. Foster homes should be placed on a minimum of a 14-day quarantine if they have a sick animal. Tools to help manage FPV in cats who are affected include supportive care and medications, such as fluids to help with dehydration, anti nausea medicine to help with vomiting, and anti diarrhea medication to help improve diarrhea, and sometimes antibiotics to help prevent secondary infections are key. Since there is no cure, the best we can do is manage any symptoms while the cat tries to fight the virus off in their own. In severe cases, euthanasia may be warranted. Cats can start shedding the virus up to 3 days before symptoms start, and usually it tapers down by 5 to 7 days. So, 14 days post exposure as a quarantine period should cover the majority of shedding. For recovered animals, sending them to a foster home with no other animals could be an option. Ensure keeping them separate at the shelter from at risk animals once they recover, just in case they are continuing to shed small amounts of the virus. It's unlikely after 14 days, but in some cases, they might continue to shed longer. Also, be sure to have appropriate quarantine protocols for exposed and affected animals in place. 14 days is an appropriate quarantine period because cats should be done shedding the virus by this point. At my shelter, we retest on day 15, and often cats retest negative by that point. To summarize, feline parvovirus is a highly contagious virus, but it can be prevented through vaccination. And in animals who are infected, we might want to take precautions to avoid spreading the disease by using proper sanitation methods, personal protective equipment, and isolation and quarantine protocols to prevent affected animals from spreading the virus to non affected animals while they might be shedding. By taking these precautions, it is very possible to prevent new cases from spreading and to give animals who are infected with FPV a fair shot at survival.